According to the Alzheimer's Association, 6 in 10 individuals with dementia will at some point wander off. And experts say that creates the potential for 132,000 interactions between someone living with dementia or Alzheimer's and an Ohio first responder. New at 6, 2 News reporter Kiana Deitch shows us how a group of firefighters is learning to better respond.
The Alzheimer's Association is working with first responders across the state, teaching them to adjust their approach to handle people living with Alzheimer's, which is a form of dementia. Understanding dementia means understanding behavioral symptoms like wandering.
So if someone's in Troy or Tip City and they really live in Vandalia, the reality is they may be wandering, they may be agitated.
Trey Addison with the Alzheimer's Association says effective communication is key to helping that person.
How are we communicating with that person so that we don't entice them to be agitated?
This year, the Troy Fire Department saw an increase in emergency medical service calls involving adults with dementia and Alzheimer's disease.
A lot of the elderly that we've been going out on the last several months have been, depressed, some agitated to the point where they're actually they get confrontational with our medics.
Captain Matthew Simmons says the increase is partially because of the pandemic.
A lot of the elderly were locked up and locked away from seeing their loved ones, and definitely looked different this past year. So we're starting to see how that affects them from the side of their mental health.
Because of this, his firefighters will be trained on how to understand the symptoms and effectively handle a person experiencing them.
Hopefully, we can de-escalate the situation from, not having to use a physical restraint, not having to use a chemical restraint for medicine, but sometimes we do. But if we can try to de-escalate that before we have to go to other methods, that's what we aim to do.
Kiana Deitch, 2 News, working for you.